Hello everyone, so I am Jason, and today we're going to be talking about the drug Famotidine, and we are going to be targeting specifically the pediatric and neonatal population for this drug. Alright, so let's begin with some general information about Famotidine. So this drug is primarily going to be used for GI disorders and discomfort, and also something called GERDs, which stands for gastroesophageal reflux disease. And this sounds a lot more complicated than it is. Basically what is happening, the contents of the stomach is moving upwards into the esophagus. So normally between the esophagus and the stomach, there is a closing, which is called a sphincter between the two. But what happens is when that sphincter opens up, or it's weakened, so it's a little bit open, the contents from the stomach will move upwards to the esophagus, and the acidity of that contents kind of causes that heartburn sensation in the esophagus. So when this happens more often, we're going to call this GERDs. Alright, so Famotidine, it is something called an antihistamine, and a specific type of antihistamine, it's going to be targeting H2 receptors. Now we'll talk about that really soon, but for now just keep that in mind. Now, Famotidine is a very popular drug. I'm sure many of you have heard of it. It's also called Pepcid as its brand name. Now, just because it's over the counter doesn't mean that a doctor won't want to prescribe it to you. So it can't be prescription, but it would be probably the same thing as the over the counter. Alright, so some considerations about Famotidine. Now, even though this drug is an antihistamine, another drug called Benadryl won't have any interactions with Famotidine. And now that is because Famotidine is going to be targeting H2 receptors, histamine 2 receptors, while Benadryl is going to be targeting H1, histamine 1 receptors. So there's no interactions because of that. Now, this is a small little thing here, but Famotidine can sound like fluoxetine. And you might be saying, why did I include this? Well, fluoxetine is a very, very common anxiety drug that many adults are on. So if you have a child, giving this for a pediatric population, Famotidine may look like fluoxetine if you're grabbing it quickly. Alright, so some adverse and side effects for Famotidine. This drug can increase your likeliness for having something called necrotizing enterocolitis. Now, this is a serious thing because it can become fatal, and it's more prominent in premature babies with a very low birth weight. Now, research, it's a little shaky on why this can happen. So what could happen is the pH within your intestines can increase. Now, this is a problem because it can affect your microbiome. Now, simply put, a microbiome is what bacteria and other organisms are within your intestines and your body. So if your microbiome is going to be changing, this can lead to consequences. So normally the microbiome can be actually protective to you. So if it is getting rid of your microbiome by replacing it with more damaging bacteria, this can be a reason what is causing the necrotizing enterocolitis. Alright, so prolonged treatment with Famotidine can cause a deficiency in vitamin B12 absorption. Now, the most common side effect you'll find in babies is agitation. So baby agitation can be a variety of different things, but you may see the baby is crying more, you may see that the baby is squirming more, throwing its arms and legs more, it could be yawning more, looking around more, sneezing more. So let's talk about now the dosing. So of course with dosing, you want to follow what your doctor says, but this is some of the guidelines that I found in UpToDate the database. So for infants 3 months and younger, what we want to be doing, we want to be giving 0.5 milligrams per kilogram. And this is going to be once daily for up to 8 weeks. Now, if your doctor chooses, you can also do 1 milligram per kilogram once daily too. Now for the pediatric population, for greater than 3 months, but less than 16 years of age, we want to be giving 0.5 milligrams per kilogram, but this time twice a day. Or if your doctor chooses, you can also do twice a day of 1 milligram per kilogram. If you're curious about the tablet form, I have the dosing here for it too written. Alright, so because drug calculations can be very confusing, I put up some of the calculations here. So first thing we got to do is convert from pounds to kilograms, because that's how they're going to be dosing this. So say you have a 15-pound baby. The conversion from pounds to kilograms is using 2.2. So 15 pounds is going to be 16.8 kilograms. Alright, so the next thing that we want to do is use a conversion. So 0.5 milligrams is going to be 1 kilogram for this drug. So if we do some cross multiplication, we end up getting 3.4 milligrams as being the dose that we want to be giving for this. But now, because this is a liquid that we're going to be giving, we're not going to be giving it as a milligram. We're going to be giving it as a milliliter. So what is the concentration that we're going to be doing it? It is not going to be 100% pure drug that we're going to be wanting to give it. We're going to be titrating. We're going to be dissolving this in other substances. It's not going to be a pure milligram to milliliter. So the conversion that the manufacturer says for this, it's going to be 8 milligrams per 1 milliliter. So now how do we get to our final milliliters? It's going to be 3.4 milligrams divided by 8 milligrams per milliliter, and that is going to give us 0.4 ml. So this was just a quick example of how I got to my numbers, but this is going to be for the population of infants less than 3 months old. So if your doctor said to give this drug twice a day, you'd be giving 0.8 ml, per a day, 0.4 in the morning, and then 0.4 12 hours later. Now, if your doctor decided to give you 0.8 in the morning and then 0.8 later, that'll be 1.6 ml. Now, it all depends on what your doctor wants to prescribe. I wrote here on the right what some of the calculations would be. All right, now talking about the mechanism of action for this drug. It's a fairly straightforward mechanism, honestly. So, like I said before, this is an antihistamine, so it's going to be blocking the receptor that histamines are going to be trying to bind to. Now, specifically, it's going to be binding to the H2 receptors, blocking histamine from activating the H2 receptors. So where would we find H2 receptors? We would find H2 receptors on something called parietal cells. Parietal cells are what produce the acid within the stomach. So by blocking the activation of H2, which produces the stomach acid, this is going to be reducing the acid contents in the stomach. So when you're having a GERD, it's going to cause less irritation of the esophagus because there's going to be less acid production. Alright guys, so I know there's a lot of information here, but I tried my best to gather everything that I thought was going to be very important for the pediatric and neonatal population. So I hope you enjoyed. And, if you have any questions, please ask your local healthcare provider. Alright, please like this video, please subscribe. Thanks. See you in the next one.